Hello everyone and welcome to week 10. So as you probably have guessed, we are just 1 week out from your final exams. So this week is going to contain a little bit less material, but still stuff that is very important for you guys to know. So this week we're focusing on the review of systems, which is going to be dealing with one chapter this week, which is chapter 36. Pages 819 to 823. So let's go ahead and take a look at those few pages a little bit more in depth. So again, this chapter is discussing assisting with physical examinations, but the section that we are going to look at and focus on is the sequence of the procedures in a physical exam. A medical assistant will need to know the specific order that a physician will be using during his physical exam. But please note, the review of systems is not completed by the medical assistant, but that is the physician's job. Now, what we will be doing during this exam will be the past medical history, the chief complaint, and the history of present illness. The past medical history is the part of the history that includes all diseases and medical problems that the patient has experienced in the past. Then we will review the chief complaint, which is the reason for the patient's visit. And then after all of that, we'll review the history of present illness, and this will contain details and descriptions on the symptoms that the patient has, such as the onset, the duration, and the intensity of each symptom. Now, after all of those have been reviewed, the physician will do a review of systems. This is completed from head to toe, and it focuses on the evaluation of all the patient's body systems. It will review the systems starting with the skin, then hair, nails, head, neck, eyes, ears, nose, and throat typically all go together. And then we'll look at the heart and the chest. We'll look at the arms, the lungs, the breasts, the abdomen, the genitalia, the rectum, legs and feet, and then the neurological systems. So let's talk about each of those a little bit. With the skin, the physician will inspect and palpate the skin. This will indicate the patient's nutritional level and hydration. Hair will be next. They'll look at the color, texture, distribution, quantity, and growth patterns. This will help to determine if there are any conditions such as alopecia, which is hair loss. Then we'll look at the nails, which again will look at color, texture, size, and shape, looking for possible circulatory problems or fungal infections. The physician will then examine the head for the size, shape, and symmetry. He'll also examine the scalp for any parasites, lesions, flakes, or irritations. The face of the patient will also reveal a lot about their state of health and their stress level. Then they'll assess the neck for range of motion, pulsations, texture, color, lumps, masses, and swelling. They'll look at the eyes. So prior to a physician exams, they may ask you to perform an acuity test. So remember, this is something that we talked about in Module 2 when we talked about eyes. The provider will examine the visual field of pupils and the reactions. Those reactions will be to light and other accommodations, and he'll also look at the structure of the eye. He'll examine the ears, both internally and externally, for color, shape, size, and position. They'll also perform potentially a hearing acuity test, like we discussed in Module 3. He'll look at the nose for internal and external color and symmetry. He'll also possibly test your sense of smell. The mouth will be assessed with the lips and the inside of the mouth for symmetry, moisture, color, and lesions. The tongue will also be examined for texture, color, size, shape, symmetry, movement, and position. The throat will then be examined with the patient sticking out their tongue and saying, ah. In doing so, the provider can examine the vulva, the uvula, tonsils, and the throat for color, size, shape, symmetry, and movement. This will also help the provider test for the gag reflex. In looking at the arms, the joints and the pulses will be assessed, as well as the strength and the range of motion. The heart will be assessed for sounds of the heart, looking for rate, rhythm, pitch, and quality. The chest will be assessed for symmetry during breathing. They'll also assess for any pain, tenderness, lesions, lumps, and temperature. At this time, the spine will also be looked at and noted for any of those conditions as well. The lungs, they will assess the breathing and the breath sounds, making sure that to note rate, rhythm, pitch, depth, and location. The breast will be examined for both males and females, looking for any and providing the assessment of the shape, size, symmetry, texture, while all looking for any discharge, lumps, masses, pain, or tenderness. They'll next assess the abdomen for symmetry, texture, temperature, and movement. The provider will also listen to the bowel sounds for frequency, pitch, gurgling, or any clicking sounds. Now, because the abdomen is broken into 4 quadrants, the provider will listen and tap the organs in each quadrant, looking for signs of masses, position of the organ, and the muscle tone. For genitalia, they will look at this for both males and females. For the females, they will examine the internal and external genitalia. For males, they will examine the external genitalia, and a testicular exam will be performed. They will then look at the rectum and assess for any lesions or masses. Most physicians will only do this if they're after age 40, and they will also do an occult blood test. The legs and feet will be examined, and what they're looking at is the joints and the pulses. They'll also look at strength and range of motion. And finally, the neurological exam system. The provider will assess the reflexes and observe how the patient walks, their facial expressions, and their sensation responses, speech, and movements. Now, those don't all get examined at every single visit. There are 3 types of review of systems. Those are your problem pertinent, extended, and complete. Now, I am not going to go too much into these as your discussion board this week is actually over those. But please know there are 3 types, and the provider doesn't use every single one at every single visit, depending on the type of practice they run and what the patient's chief complaint is, will really determine which type of review of system the provider will be using. So for this week, we are going to talk about your homework here. It's just a few pages that you need to read this week, guys, so I would really highly recommend that you do read through that and you actually pay attention to what you're reading. But for your discussion board, there is a link in your discussion board, and your discussion board is going to be talking about the different types of review of systems. So what you'll want to do is click on that link that is available. It's the CMS Evaluation and Management Services Guidebook that is available for you guys. And you will need to explain the differences between the 3 types of review of systems. Now, while we do give you that service guidebook, you are able to look up these answers on your own. But make sure that when you're doing this, you're not just simply stating what's the difference. Give examples, but make sure they are in your own words. Copying and pasting straight from the guidebook is highly, highly discouraged. And if you do that, your discussion board will not be accepted. Okay? Your initial post will be due Tuesday, September 5th by midnight. and you'll have to reply to at least one classmate no later than Saturday, September 9th. There's no quiz this week, so it's just your discussion board, and you also should be preparing for your final examination. All right, guys, that's all I have for week 10. Please make sure, again, you read your couple of chapter pages. And if you have any questions, comments, or concerns, please reach out to me. My direct line to the Rockford campus can be found on your course homepage in the top right corner by my picture. Otherwise, you can reach out to me via course messaging in Blackboard. And I look forward to what you guys put together for your review of system discussion boards. Bye, guys.